If in the event that deep cleaning is necessary or required in a office space, we will most likely have that performed um, off normal duty hours. We're not going to send in the cleaners to disrupt anybody during the course of their workday, and so it will be done according to the schedule that was presented, but it will definitely be done in a way that's not disruptive. Next,
There is from the office of the chief academic officer.
There was some muffling there, but I'm assuming, Alex, that was an introduction. Good afternoon, Firebirds. I hope that you all had the opportunity to join us earlier today for the Fall 2021 opening convocation to hear our keynote speaker, Attorney General Carl Racine, and our President, Ronald Mason. There are a couple of items that I'd like to just kind of speak to this afternoon in quick fashion. As of September 15th, we had 1,588 students who were registered for at least one in-person or hybrid course. We continue to look on a case-by-case basis at students who may have been administratively dropped from a course in error, or if there were any lags or bottlenecks in their clearance process and banner. If we are finding that there was an error on the part of the university, we have done the mid-course correction to make sure that students have been re-registered. And so that particular process is ongoing. There have not been very many, but we recognize that errors did occur in some of the bottlenecks and the lags in terms of clearing holes. Students who have exemptions are required to be tested weekly. And as you will see both from the town hall meetings on Thursday and the COVID newsletter that goes out, the data from these tests and the testing data are reported. So do understand that religious and medical exemptions have very stiff requirements, and students who have been exempted are required to be tested weekly. September 15th was the extended deadline for documentation. This speaks to bullet number 1. So we are continuously making sure that we have done what we needed to do institutionally and from a compliance perspective to make sure that we have met our goals and that we have restored any student who was erroneously administratively dropped due to a university backlog. I want to just kind of point out to any of the students that are on this call, early registration is an important aspect and an advantage for all of you. The university has made tremendous investments in helping to pay down account balances so that balances are not carried into the future semesters. For those of you who have balances, you need to work with your financial aid to try to get those balances down. But the university has made significant investments in student aid. And so I say all that to say that if you do not have a balance that exceeds the regular amount, when registration opens on November 2nd, every continuing student should be trying to pre-register November 2nd. The pre-registration process for continuing students opens November 2nd and it goes through January 2nd. And that early registration means that you will have more available modes, whether that is face-to-face, whether that is emergency remote or virtual, or whether that is fully online or high flex. Those courses are all empty when they open on the 2nd, and so you have your pick of the litter if you register early. Secondly, if you register early, you get more course diversity. There's more choice. More of the kinds of courses that you want are available to you. Those courses fill very quickly. They are limited in number. And so therefore, if you wait until the last minute, you don't get the courses that you like. Personal protection equipment. You heard Chief Operating Officer David Franklin talk about this earlier. We are strongly encouraging any faculty, any staff, or any student needing PPE to request that through signing on to the Live Safe app. I have my own hand sanitizer and my wipes in my office, and so I would strongly encourage you to do the same thing. And a new kind of promotion that we will be pushing on the side of academic affairs is, because we do have a mask mandate, no mask, no class. If you don't have a mask on, you're not going to be getting in the classroom. And so we ask every student and every faculty member who are in an in-person or hybrid course to really, really focus in on being respectful and wearing the mask. It helps to reduce the spread, and given the fact that this is flu season, it is even more critical for individuals to make sure that they are masked. So that is the update from Academic Affairs.
Thank you, Dr. Potter, and I apologize for the muffled introduction. I'll try to speak a little bit more loudly. So a lot of questions came up in the last town hall regarding testing on campus, and we've thought this through and to introduce an initiative on campus for surveillance testing. I'd like to introduce Chief of Staff and Senior Vice President Dr. Guillory.
Hi, good afternoon, everyone. So we do take the questions and the comments and concerns that everyone posts in these forums very seriously, and we've heard clearly that there is a desire to see more testing taking place on campus. And I checked with campus health and with Nurse Mercy, and she informed me that we're testing about 25 people a week, and that includes the 15 individuals who have to get tested on a weekly basis, who have approved exemptions from being vaccinated. And so one of the things that we're going to do next month, and you'll see more information about this, but we want to kind of just introduce it today, is a Get Coffee Not COVID promotion, where on Tuesday and Wednesday, October 12th and 13th, I think I have the dates wrong on the table of contents for this, but on Tuesday and Wednesday, October 12th and 13th, we're going to push to get 100 people tested. Okay, we're going to set up in the student center, and the first 100 people who come by to get tested will receive a $10 gift card to Starbucks. And what we want to try to do, it'll be a walk-up service. We want to try to just test a critical mass of people who are circulating on campus, just to determine whether or not we capture anyone who might be asymptomatic and positive. Because we do want to reiterate that if you are symptomatic at all, if you have any symptoms that might be affiliated at all with being infected with COVID, you should not be coming to a UDC work site. You should stay home. And we really want to implore people to understand, if you do feel sick, do not come to campus to get tested. Try to find another site, another place where you might get tested. I mean, making a visit to your primary care physician, if you can get in. There are a lot of even CVS's. I think we've posted on the RISE website where you can get tested in the DMV area. But on that day, we're expecting that, to try to get 100 people from the Van Ness campus to get tested that day, and those 100 will receive a $10 Starbucks gift card. We're exploring what are the options to replicate this at other UDC campuses, so stay tuned for that. You don't have to wait until the 12th and 13th to get tested. I know that the health center is accepting walk-ups on Tuesdays and Wednesdays for people to get tested. So if it occurs to you, hey, I was at a friend's house and she's not feeling well today and she got tested, maybe I'll get tested, and you want to go and get tested, you feel fine, that's why you're on campus, but you want to go ahead and get tested, you can do that. But we really just want to kind of test a critical mass, a proportion of our community on those 2 days, just to get a sense of, some reassurance about our negative test rates. Stay tuned, you'll see more about this promotion in the coming weeks. That's it.
Thanks, Dr. Guillory. Get coffee, not COVID. So I think I want to open it up now, some of the questions that people might have or any additional comments that the panelists or um, perhaps President Mason may have. I see one question from Dr. Osasanya. Yes, do faculty, people, and students know that if they're experiencing flu-like symptoms, they must not come to campus? The answer is yes. We've been promoting all along that people who feel ill should stay home. Do not come to work if you have any symptoms at all that are flu-like, sore throat, runny nose, fever. Do not come to campus. Another question from Megan Kowalski. With renovation starting in building 39, do you have any anticipation of the noise level of the work? The library is on the B level, and many students prefer quiet study space. Perhaps that would be a question best answered by Chief Operating Officer David Franklin.
Yeah, I appreciate the question. So the work that we anticipated taking place on the second floor will not have any impact on the library. It isn't the work that we're doing is the noise level will not be that high where it would be disturbing to anyone else. The only the only other area that's in close proximity to the work that we're doing is the cashier's office. And again, we don't anticipate that being an issue with the noise traveling to either the third floor, which is above, or even the first floor below that as well. So we don't anticipate that being an issue at all.
Great. Thank you. Another question from Tanya Taylor. Do you want to test those that have been vaccinated? Tanya, the answer is yes, we do want to test those who have been vaccinated. We want to test those who are on campus, and vaccination is a requirement for being on campus. So the individuals who, the small number of individuals that have exemptions and that can be on campus because of those exemptions will not be tested in that group. And so the individuals for the Get Coffee Not COVID initiative will be likely those who have been fully vaccinated. That's the target. Any other questions? Please ask them now. I don't see any raised hands. We have some time left. Well, I will mention that it's come up a couple of times that it is flu season. We are anticipating a somewhat more severe flu season than we experienced last year, and maybe even more severe than in a typical year, because our natural immunity is probably dropped for influenza. I do believe there will be a flu vaccine provided on campus at some point. Please stay tuned for that. And certainly, I know that at CVS and other pharmacies, you can get the flu vaccine right now. So be mindful of that. And definitely, we don't want you to get COVID. We don't want anybody to get the flu if that's preventable. Questions? Ask them now, please. All right. Let's keep it open a couple more minutes just to make sure. I know that we have at least 40 individuals participating today, 50. So maybe some people are joining late. Maybe they have questions. If there's anything you need us to repeat, to go over again, please let us know. This information will be posted on our RISE website.
Alex, we just want to remind people to please inform everyone that we will be hosting these town halls every other Thursday. And on the alternate weeks when we don't have a town hall, we will be updating, sending out COVID updates. One of the things that we wanted to attempt today is to just poll those people who are on this forum to see what level of comfort they have with our current COVID protocols. And I think that Jay is going to post that, I think, in the chat, and they can just either, it's just a scale from 1 to 5, and just asking everyone who's on right now, just so we can get a sense. You know, people may not have specific questions, but just to get a sense of what are people feeling. I know in the administrative council meeting, President Mason asked that question just to solicit some feedback from people, because we're still relatively new at the work sites and on campus, and just to get a sense of what are people's comfort levels, how are people feeling. And certainly coming to a forum like this and receiving this information should help to allay any fears or concerns. So I think if you go to the chat, there's a link, you can click on it, or just put on a 1 to 5, 1 being a low level of comfort, 5 being a high level of comfort, just to let us know, give us some feedback on how you're feeling about things.
Alex,
Yes, sir.
I don't see any more questions, so let me say this before you sign off. First, thank you for hosting this. Your MC skills are getting better and better each and every forum. Let me thank the cabinet. I thought this was an excellent briefing, and the more information we get out there, the better. Let me thank Dr. Guillory and her team for pulling this together. I think her experience in heading up this effort at Morehouse College of Medicine has really helped us do what needs to be done to keep everybody in the loop. So that's all I have to say. I could tell another joke, but I only had one today. And for everybody else, thank you for what you do. I would ask one thing. When I pass through the student center, the area where the students shoot pool, they have a tendency to pull off those masks when they are on the tables. And when I walk by and remind them, they always put them back on. And so when you're walking by there, just remind them, you know, they're young and they forget. So let's help them remember when we go through the student center that those masks are important. Okay, that's all I have to say. Thank you, everybody. Steady the course.
There's one more question in the chat, and I think this is a question for CAO Franklin about a group of engineers coming from Canada to give equipment training to some faculty. And the question is it sufficient to let them know that they must be vaccinated to visit UDC campus and they must wear a face mask? And I think we need to clarify that. I think everyone who works or attends UDC, all our employees and students must be vaccinated. But I don't think we necessarily have a vaccination mandate for people who are coming to campus for something like this. Am I wrong in that assessment, Alex?
No, no, Dr. Giller, you're not wrong. Right now, there are no travel restrictions for coming into the District of Columbia. There have been in the past throughout the pandemic, but those have been dropped as of now. If there are travel restrictions, particularly regarding international travel, they will be posted online on our RISE website.
Professor Osasonia, Lawrence Potter here. While there may not be any restrictions in the district, the university does have a mask mandate and a vaccination verification policy. And so it would be incumbent upon you to notify your colleagues visiting from Canada that we do have a vaccination verification policy, although we will not be asking them for that verification. However, they must wear a mask at all points and entries on the campus. It is critically important with you as the host to make sure that your guests are following university protocol.
All right. Thank you, Dr. Potter. With that said, I don't see any more questions, and so leaving that with President Mason's
Alex,
approval.
I
Yes.
think Laverne Gooding Jones had a question.
Okay.
Laverne, did you have a question you wanted to ask? I just saw it in the chat. I don't hear her. So
I see that now as well. Laverne, please ask your question or type it in the chat. If not,
Oh, here.
let us know.
Let's see, I was trying to unmute her. And she didn't type it in the chat.
Well, Laverne, please send your question to COVID Confidential and we'll get to it. We'll get you a response right away.
Me?
Oh, there she is.
There she is.
Okay. Everyone hear me now?
Yes, we
Yeah.
can.
Okay, I have a question in reference to parents, grandparents who have children that are in DC public schools and charter schools. I'm home now with 3 children who had a student in each one of their classes that tested positive for COVID. They're on a 10-day quarantine and theirs is over. In fact, I took them to have them tested yesterday. But the rules are so different as compared to what we're doing. When we have children and we're following the guidelines, one of the guidelines said that if one child doesn't have it, they can continue to go to school while the other ones, I mean, if one child class does not have anyone in there that had it, they can continue to go to school. My concern is no, I'm having them all stay at the same time. We know we have a lot of parents, students that have children. Myself, I'm raising grandchildren. What is the university's policy when it comes to that, when we're dealing with what the policies that they say in the schools with our children? It seems to be kind of different.
Sure, I can take a stab at answering that and maybe somebody else can jump in. The DC Public Schools has implemented a multi-layered approach to determining close contacts. And so it's slightly different than even what DC Health is recommending for the general population. And so in some cases, if a student is tested positive, they're not necessarily going to quarantine each student that was in that classroom. They're using a number of different criteria for determining what is a close contact for staying home. And so that's completely different than what the DC Health is recommending for the university. If and I sort of covered this in the very beginning of this town hall, but if you do have a family member, somebody that that tested positive and needs to be at home, and if you need to care for them, then you should make arrangements with human resources or through SDS to do that. That does not automatically mean that you should stay home because you're on quarantine, but that you can, if you have special needs, if there's a special circumstance that requires you to stay home, you should do that.
So Alex, I'll add to that. Deb Sullivan,
Okay.
Vice President of Human Resources. So Laverne, as you know, the COVID leave has gone through a number of iterations that DC government has provided. And currently, well, early in the process, it granted leave to parents to be home with their children when schools were closed. That has since changed. And so with each case, it's a little bit different. So as Mr. Bako stated, if that's a situation where you are required or family members are required to quarantine and you're part of that, you simply need to submit it to COVID Confidential and we will work with each case individually. Okay? But you're right, the rules are very different.
Okay. Thank
Well,
you.
we have another question. we have another question from our athletic director, Patricia Thomas. What is the district's mask policy outdoors? I see a number of community folks walking up and down Connecticut Avenue and across campus who are not masked. That's a good question. I think the district's policy is outdoor masking in situations in which you are alone has generally been acceptable, or has been acceptable to not mask if you are alone and walking outdoors. If you're outdoors, certainly in a group where you might be less than 3 to 6 feet apart, you probably should wear masks. And I think that's what the district is recommending right now. Yeah, but I do see people on Connecticut Avenue. I even see people on campus outdoors who are unmasked. And again, if they look like they're by themselves, I don't do anything. But if I were to see a group of people together in close proximity to one another outdoors, I would anticipate that they should at least have their mask with them and wear them. Sure. Any other questions? If not, we're going to adjourn this town hall. Wish everybody safe times at UDC. Continue your work, your studies. Be safe, protect yourselves, and we'll see you 2 weeks from today. And be on the lookout for a newsletter in the week in between. All right,
I just
everyone?
want to remind everyone, this presentation and the recording of this town hall will be posted at the RISE website. So if anyone missed it, you can refer them to that, and this presentation and the town hall will be posted there. Thanks, Alex.
All right. Thanks, everyone. Bye.